Hello again. In this video, we will be discussing the frontal site. At this site, there are two main nerves, the supraorbital and the supratrochlear nerves. If you're experiencing pain that stems from these nerves, your pain will start here mid-eyebrow, and it will radiate up the forehead or around the eye or towards the temple. In order to diagnose this pain, we will look at your pain drawing, which will show a similar pattern to that I just discussed. We will also perform a trial of Botox, which can help a lot of patients long term. If Botox doesn't help, we may perform nerve blocks, which will tell us whether your nerve is involved in the pain or not. And nerve blocks can help some patients long term. But if all these measures fail, you may be a candidate for nerve decompression surgery. Before surgery, we oftentimes get a CT scan to evaluate the periorbital area because your nerves can travel either through a supraorbital foramen or a supraorbital notch. A lot of times when the nerve travels through the supraorbital foramen, what it means is that the nerve travels through a bony tunnel and it can be entrapped there. And this phenomenon is more common in patients who have this type of pain. So we want to know if you have a foramen or a notch prior to surgery for surgical planning. Surgery is performed through an upper eyelid incision right here in the eyelid crease. So the scar is hidden in the eyelid crease and will not be visible after your scar has healed. We then try to find the nerves, which are located here in the middle of the eyebrow, and we follow them towards the frown muscles in this area. We free them from the frown muscles, and we also look at the supraorbital area to determine whether there's a notch or foramen. If there's a notch, there's a tight band oftentimes that pushes on these nerves, so that band is cut. If there's a supraorbital foramen and the nerve is stuck in the foramen, then we open up the bone to give the nerve space to breathe and decompress the nerve. After the nerves are freed, we cushion the nerves, oftentimes with a little fat that's located in this area, or fat grafting that's taken from another part of the body.